Hi, Dr. Yass here. I'd like to talk about strength training versus other forms of exercise and its ability to address weakness that is the core reason for dysfunction and most people's pain. I would have to say that at least 95 to 98% of cases of people suffering from pain, the cause is actually muscle weakness or imbalance. This stems from the theoretical basis that the Yass method promotes as to why people have pain, and that is that there is a certain force requirement for performing functional activities as a result of having to work against the gravitational force that's pushing down on you. And muscles have to create a certain force level to be able to respond to the force requirements of the activities. If the muscles aren't strong enough, then they will break down, elicit pain, or they can cause another muscle to try to compensate, break down, elicit pain, or it can lead to a misalignment of the joint surfaces that the muscles attach to, and that can lead to pain at joints. In most cases, the pain associated with joints is actually unrelated to the structural elements of the joint. It's simply that there's a misalignment of the joint surfaces because the muscles that attach to the joint surfaces are either weak or imbalanced, causing a misalignment. That's why the joint surfaces rub in the way they shouldn't. That's why you get joint pain in most cases. So I believe that there is this premise from most medical professionals and even fitness professionals that exercise is kind of all the same, and whether you're doing strength training or Pilates or treadmills or bicycles or aquatic therapy, that somehow these are all the same, that the benefits and the actual mechanisms by which they work are the same. And it's just ridiculous to perceive that. It's completely different. Isolated strength training, which is one of the core components of the Yass method, relates to the ability to, first in the diagnostic aspect, identify which particular muscles are either weak or imbalanced, leading to the inability to perform functional tasks, which ultimately create symptoms. So first, you have to be able to identify that the cause is muscle. Then you have to be able to identify which particular muscles are weak or imbalanced, leading to dysfunction and the presentation of symptoms. Once you've identified the individual muscles, then you have to know how to perform isolated exercises that isolate the weakened muscle, work only the weakened muscle or the imbalanced muscle, so that the particular muscles that are leading to dysfunction and symptom can be addressed in an isolated fashion. Then you have to be able to utilize a mechanism to cause the muscle to get stronger, because if there is an acknowledgement that the muscles are not creating enough force due to weakness or imbalance, and that's why the force output of the muscle is less than the force requirement of the activity, that's why you're having dysfunction and symptom, then you have to find a way to increase the force output of the muscles. This can only be accomplished through the use of progressive resistance. This means that the muscle is put against a certain resistance as it goes through the range of motion at the joint that the muscle works or moves, and the goal is to cause it to adapt to greater and greater resistances. As the muscle adapts to greater and greater resistances, more muscle is created, thereby making the muscle stronger. So if an activity that is supposedly being done to accomplish something in terms of developing greater strength of muscle to allow for a greater ability to perform functional tasks so that they can be performed without symptom, you have to incorporate some sort of progressive resistance. Any exercise, let me be very clear, any exercise performed without a form of resistance that is progressed has no value. in altering the strength output of a muscle. I'll say it again. Any exercise that is performed without an attempt to cause the muscle to adapt to greater resistance, therefore there must be some mechanism, whether it's a piece of equipment, a resistance band, a resistance tube, something has to be causing the muscle to adapt to a resistance and then be able to progress the resistance. Without this implemented, any form of exercise will do nothing to cause the muscle to get stronger. So if we're looking at these other forms of exercise that are supposedly the equivalent of this, whether it's Pilates or treadmills or bicycles or yoga, basically any for aquatic therapy, any of these forms, when you look at how the activity is performed, you would see that all of these forms of exercise are actually performed as mass muscle movements, meaning that many muscles are being utilized at the same time to create the movement of the activity. Swimming, treadmills, bicycles, Pilates, aquatic therapy. You're moving a lot of stuff at one time. That breaks one of the pure core elements of what it means to isolate a muscle. If you're doing Yass method exercise, then what you're doing is you're staying in a very stable position. You are only moving the joint that muscle moves. You're going through the appropriate range of motion against the resistance while that singular muscle is moving that singular joint. The rest of the body is completely stable. So Yass method exercises are typically done in a very stable situation, either sitting or even if you're standing, you are supporting yourself with both arms and one leg. So it's a very, very stable type of exercise. But the key is that you're only moving one joint at a time. Full range of motion against a resistance. That is how you isolate muscles. Look at all the other types of forms of exercises or treatments, if you will, or therapies, whatever people want to call them. You will see you're moving a lot at one time. That makes it impossible for any particular muscle to be isolated. And if, in fact, the cause of your symptoms and dysfunction is that specific muscles are not strong enough to perform these tasks without breaking down, then you have to be able to strengthen them and isolate them. That has to be one of the purest reasons why Yass method exercises surpass any form of treatment, any type of therapy, because it has the capacity to isolate muscles in a safe and effective manner. It has the ability to identify what the appropriate resistance is and then be able to progress that resistance in a safe and effective manner. You're very stable. All your energy is going towards the increasing resistances of the isolated muscles, which allows you to maximize your ability to gain strength in all the appropriate muscles, allowing those muscles to be able to perform the activities you're trying to without breaking down and elicit symptoms. So, if you have tried a multitude of treatments or therapies and you're not getting better, here is the reason why. You are not utilizing isolated strength training, implementing progressive resistance. Anything other than that will do nothing, and I mean nothing. And most of you have already recognized that and experienced that. If you've gone for therapy, you've gone for treatment, you've gone to a fitness person, you've gone to a gym, what you've recognized is everything that's being done doesn't achieve the goal of resolving your symptoms and allowing you to achieve full functional capacity. The only thing that will is isolated strength training, utilizing progressive resistance. It is one of the core components of the Yass method. The Yass method separates itself by initially in the diagnostic component, utilizing an interpretation of the presentation of the symptoms that the body presents to identify the proper tissue eliciting the symptoms you're experiencing versus diagnostic tests, completely invalid. Every bit of evidence, scientific, clinical, and theoretical, proves it. It needs to be abolished. That's just a fact. So you need the proper mechanism to diagnose the cause of the symptoms. In 95 to 98% of cases of people suffering from pain, the cause is muscular. Therefore, you best know how to isolate muscles, identify the appropriate muscles, then isolate them, strengthen them in an effective manner. That is your only one true path towards resolving your symptoms and achieving full functional capacity. That is really the difference between Yass strength training mechanisms and every other form of therapy or treatment that supposedly will help you. You've experienced it, it's not working. You just need to find the Yass method. So if you want to find more about the Yass method, you can go to my website, www.mitchellyass.com, mitchellyass.com. You can email me at drmitch@mitchellyass.com, mitch@mitchellyass.com. I'm even giving you my cell phone number. That is 516-449-1359, 516-449-1359. I implore you to find the Yass method, find out how to implement it so that you can finally end your symptoms and get the life back that you so justly deserve. You should not have to suffer in pain hopelessly because of a system that is incapable of recognizing what is the only true path to properly diagnosing you and then treating you. You need to get the Yass method. Please, for your sake, find it, use it, resolve your symptoms, get your life back. This is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.